Good evening, all doctors. This is Yaseen Sharif, second year 𝗵𝗵𝗿𝗲, Tagore Medical College and Hospital. Today, we are going to discuss a very important, one of the major nerve of the upper limb, that is the ulnar nerve. Okay, ma. So this nerve is not a repeatedly asked university exam point of view, but this has asked for 4 to 5 times in university examination. So the priority of this nerve to be asked in the upcoming university examination, that is on the 2022, is very high, ma. Okay, it's very high. So 2022 or 2021, when is the university exam? So it's very high. So please do listen, doctors, okay, for the another 40 minutes. Okay, so and also this ulnar nerve is very important. Okay, so this all the nerves, ma. So this ulnar nerve, radial nerve, and median nerve, all the nerves. Okay, you have to know the 𝗏 anatomy of these nerves in order to know the 𝗏 anatomy of upper limb. So once you know the 𝗏 anatomy of all these nerves, upper limb is very simple, because these upper limb is dealt with these main 3 nerves. Okay, because the patient comes with all major symptoms of the patient comes with major the symptoms of upper limb, so through these nerves only. So doctor, I have some numbness in my hand. So it will be some injury in any one of these nerves. It can be anything, ulnar nerve, median nerve, or radial nerve. So you have to know the 𝗏 anatomy of these nerves. Okay, so we'll start. So who are these, ma? Okay, who are these? Okay, we all know, right? So these two 𝗔𝗵𝒂𝗏𝗏s, right? So music 𝗵𝒵𝒂𝗏s we'll say, right? Music 𝗵𝒂𝗏s, the A.R. Rahman, Yuvan Shankar Raja. So why I have put this pic in the ulnar nerve? Is something related to ulnar nerve? Yes, it is related to ulnar nerve. So this musicians are related to ulnar nerve, because ulnar nerve is otherwise called as musician's nerve. Okay, why it is called as musician's nerve will be dealt in the upcoming slides. Okay, so have a question mark why it is called as musician's nerve. Okay, right, ma. So the objectives of this session is, first of all, we are going to see the root value. What is the root value of ulnar nerve? Okay, from where it arises. Okay, and what is the cause and relations of the ulnar nerve, and finally the clinical anatomy behind the ulnar nerve. So first of all, I'll say how to write any particular nerve in the university examination or any examination in the first year. How to present a paper when this median nerve or radial nerve, ulnar nerve, these 3 nerves comes in an exam. Okay, so first of all, right, what is the root value? Okay, so always these 3 nerves, na. So please present it has a flow chart, ma, because when you write these nerves as a paragraph, no, so the examiners will be getting irritated. Okay, so to find many words, many muscles, many nerves, many relations will be there, so they will be getting irritated, and they will put some few marks only. Okay, so when you present it has a flow chart, okay, like this, when you present it as a flow chart, so it will be looking very appreciable and very nice and good looking. So the patient the examiner will have a thought that you have know something about the nerve and you have presented very well. So this will fetch you about some 10 to 12 marks for 15. Okay, because it's essay question, right? So it will fetch some 10 to 12 marks, 10 to 12 marks for 15. Okay, so when you write as a flow chart. Okay, then we have to draw the diagram too. Okay, so first of all, how to write? So you write what is the root value. So what is the root value of ulnar nerve? Then start the course. What happens in axilla? Then what happens? So then put an arrow mark. Okay, ma, put an arrow mark like this. What happens in axilla? Then put an arrow mark like this. Then what happens in arm? Then put an arrow mark like this. Then if you have some branches, so then and there you can write those branches. Okay, so since I'm explaining ulnar nerve, so branches are present only in forearm and hand. So I have written the branches over here. So the same aspect follows a median nerve too. But if you take radial nerve, you will have branches in axilla and arm itself. Okay, fine, ma. So so then what happens in forearm? What happens in wrist, hand, and lastly clinical anatomy. So present the paper as a flow chart. You will fetch more marks. Okay, fine, ma. Next, so we'll start. So what is the root value of an ulnar nerve? So root value is of ulnar nerve is C7, C8 and T1 ma. C7, C8 and T1. Okay, so you may ask, okay, so ulnar nerve arises from, ulnar nerve arises from the medial cord of brachial plexus. Okay, this is what is ulnar nerve arises. So what you mean by medial cord of brachial plexus? So if you take brachial plexus, right? So you have learned about brachial plexus, because you have to understand brachial plexus. This is very important and very easy question, because all the major nerves of the upper limb, not only major nerves, all the nerves, okay, of the upper limb arises from this brachial plexus only. So you have to know the pakka anatomy of this brachial plexus. Okay, so please do read if you haven't read brachial plexus. Okay, so if you see, this is what we called as medial cord, right? This is what we called as medial cord. So where does the medial cord arises? It arises, so in medial cord forms by the union of C8 and T1 only. Then you may ask, right, so from the medial cord only ulnar nerve arises. Okay, so from the medial cord only ulnar nerve arises. You may ask, right, so C8 and T1 only contribute to the ulnar nerve, then how does it come C7? Because C7, okay, so this C7 noma, the C7, okay, so it provides few fibers to a very important muscle which is supplied by ulnar nerve. That muscle is called as FCU, FCU, okay, FCU, sorry, FCU, okay, flexor carpi ulnaris. Okay, so the flexor carpi ulnaris is also supplied by C8 and T1, but some of the fibers of C7 also contribute to the flexor carpi ulnaris. So that's why the root value of ulnar nerve has come as C7, C8 and T1. So there are some exceptions, okay, there are some expansions to some nerves. Okay, this is what the root value, you have to write this root value, which will fetch you 1 mark. Okay, so what is the root value, and where does from where ulnar nerve arises? It arises from the medial cord of brachial plexus. Fine. Now we'll start with course. Okay, so these are the course, these are the objectives. This is how you have to write. You have to present the ulnar nerve. What happens in the axilla, what happens in the arm, what happens in the forearm, and what happens in the wrist and hand, like that. Okay, so this diagram you have to draw, okay. So without diagram, if you present the paper without diagram, okay, so only as a flow chart, you will get marks. Okay, you will get marks up to 9 to 10 marks for 15. But if you draw the diagram and if you present as a flow chart, it will present to up to 12 marks, okay. So to be on safer side, please draw diagram, because this is a very important mandramnu sollama. Okay, so remember, anatomy is diagram, diagram is anatomy, as we all know, right? So anatomy is diagram, diagram is anatomy. So everywhere in anatomy, please draw a diagram, okay, for a safer side. Okay, so in course, first of all, what happens in axilla? Okay, so what happens in axilla? So ulnar nerve in axilla, see, this is what is ulnar nerve, right? So ulnar nerve in axilla, okay, ulnar nerve lies medial to the third part of axillary artery, okay. So this is what is called as axillary artery. No, this is called as axillary artery. So third part of axillary artery. So ulnar nerve lies medial to the third part of axillary artery. That is what we have to write in the first point of axilla. Okay, and the course in axilla, you write over here. You write over here, You write over here. That is ulnar. That is in axilla. Axilla, ulnar nerve lies medial to the third part of axillary artery. Okay, sorry, my handwriting is very bad, sorry. Okay, so just you write has okay, so ulnar nerve is related to medial, okay, it lies medial to the third part of axillary artery on the axilla. Okay, fine. So then what happens in arm? Axilla was over, so now what happens in arm? In arm, we'll see has two parts. Okay, one is a proximal part and another one is a distal part, because the course has a different in proximal part and in distal part. Okay, so in what happens in proximal part? Okay, in proximal part, this is the ulnar nerve. Okay, so I have shown like an arrow, right? This is the arrow. So this is the ulnar nerve. This is ulnar nerve. Okay, so ulnar nerve in proximally it's related medially to brachial artery. Okay, so see, so nothing. So in axilla, it is called as axillary artery. Once it enters the arm, the same axillary artery, okay, continues as brachial artery. Okay, that you will be dealt in the blood supply of upper limb. Okay, so nothing but okay, only single artery, there is axillary artery that continues downward as brachial artery, radial artery, ulnar artery, like that. Okay, so in arm, proximally, ulnar nerve is related to the medial side of the brachial artery. Okay, so then what happens? Then has the ulnar nerve passes downward. Okay, so at the mid humerus, that is in the mid humerus. Okay, at the mid humerus, what happens? It pierces the intermuscular septum. That is very specifically, if I want to say, there is a medial intermuscular septum. What do you mean by intermuscular septum? Okay, what do you mean by intermuscular septum? Means nothing but, okay, you will be having a muscle okay, so in the flexor compartment as well as in the extensor compartment, right? So the space between the two muscles, that is called as intermuscular septum. We have lateral intermuscular septum and medial intermuscular septum. Since ulnar nerve passes medially, it pierces the medial intermuscular septum. So where so this is very important. Where does it pierces the medial intermuscular septum? Okay, it pierces the medial intermuscular septum at the mid humerus, specifically at the insertion of 𝗂𝗵𝗿𝗂𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃𝗃 ulnar nerve pierces the medial intermuscular septum and lies in the posterior compartment. Okay, till before piercing the medial intermuscular septum, ulnar nerve lies in the anterior compartment. After piercing, it moves to the posterior compartment. Can you able to see? It pierces. There's a gap over here, right? So it pierces the medial intermuscular septum and passes the posterior compartment. Okay, so in what happens now, this is proximally is over, what happens in distally? This is what we are going to see proximally. Okay, so in arm you write, you put two headings in arm like this. In arm you put two headings, okay, in arm you put two headings. One is proximal, you write till piercing of medial intermuscular septum. Then down you write distal. Okay, distal. So what happens distally? Distally, this ulnar nerve runs downward. Okay, runs downward to the back of the medial epicondyle of humerus. This is what is called as medial epicondyle. So what do you mean by medial epicondyle means? So you'll be having two condyles in the humerus, right? You will have medial epicondyle and lateral epicondyle. The most prominent part of the condyle is called as medial epicondyle. Okay, so the prominent part of the medial condyle is called medial epicondyle. Okay, so it passes behind the medial epicondyle and lodging itself in a groove. Okay, so in that medial epicondyle there will be a groove, so it lodges itself. Okay, so here the ulnar nerve is palpated. Okay, so ulnar nerve can be palpated. Okay, so if you want to palpate the ulnar nerve, you can palpate in the medial epicondyle. Okay, so here ulnar nerve in this position in the medial epicondyle, ulnar nerve is otherwise called as funny bone. Why it is called as funny bone? Why it is called as funny bone means, supposing okay, so remember in your school days, தெரியாம நம்ம வந்து கையால டேபிள் அடிச்சு போகலம்மா. So sometimes we'll fell down, we'll hit with a rod or in the table. Okay, so in our elbow means we'll be getting a tingling sensation, like a shock sensation, right? So we'll laugh for some time like this. So shock sensation, that is due to compressing of ulnar nerve against the medial epicondyle of humerus. So that's why ulnar nerve in this area is called as funny bone. Okay, ma. So and another very very important point you have to understand, any nerve when it passes through a joint, whether it's elbow joint, whether it's a wrist joint, any joint, okay, when it passes through a joint, okay, it has to safeguard itself, because since it's a joint, it will have various movements, right? So when a joint moves, the ulnar nerve shouldn't be injured. So in order to safeguard the ulnar nerve, so what happens, it creates a tunnel. Okay, so nature has created a tunnel for the passage of ulnar nerve through the joint. Okay, same wise, so the ulnar nerve that is lodged in the groove, okay, so it's converted into tunnel. The tunnel is called as cubital tunnel, that is tunnel is called as cubital tunnel. So this is what is called as cubital tunnel. Okay, see this. Okay, ulnar nerve is coming, Okay, so after piercing the middle intermuscular septum, ulnar nerve is coming, so behind the middle epicondyle. So this groove is converted into a tunnel. Okay, so by what, sir? அப்படின்னு கேட்டோம்னா by a fibrous sheath that is extending from the medial epicondyle to the olecranon process that is present in the back. Okay, to the olecranon process. So it converts the groove into a tunnel. That tunnel is called as cubital tunnel ma. Okay, the tunnel is called as cubital tunnel, and on the tunnel oda floor la, okay, so the floor la you will be having a ulnar collateral ligament ma. So you will be, okay, so what happens, since the ulnar collateral ligament is present in the floor of this tunnel, the ulnar nerve passes above the, that is passes or crosses the above the ulnar collateral ligament. Okay, these points you have to write, man. This is what is important. This is what you have to write in arm. Okay, what happens in proximal part and what happens in distal part, this is what you have to write. Okay, fine ma. So this is very very important ma. So ulnar nerve does not give any branch in axilla and arm. Okay, so see, we have seen ulnar nerve in axilla and in arm also. There is no branches, but okay, this point is very important. You highlight over here. Okay, after completing the flow chart, okay, after completing the flow chart of axilla and arm, you highlight, you put a box over here and highlight. Okay, and highlight like this, that is ulnar nerve does not give any branch in axilla and arm. Okay, this is very important ma. Okay, so once it enters the forearm next, right? So what happens? So I'll explain with this diagram. This is very beautiful ma. Okay, so see, so ulnar nerve enters the forearm by passing between the two heads of flexor carpi ulnaris. Okay, flexor carpi ulnaris. Can you able to see two heads are there? It passes between the two heads of flexor carpi ulnaris, ulnar nerve. Okay, so this is what you have to write. This here also there are two parts of ulnar nerve. There is upper 1/3 and lower 1/3. Upper 1/3 is nothing but this part ma. Okay, that is between the two heads. That is what we call as upper 1/3. That is you have to write like this: runs vertically downward under FCU. Can you able to understand? So it passes between two heads, means this part will be under this one head, right? So upper 1/3 is under the FCU, that is flexor carpi ulnaris, and lower 1/3, okay, it passes superficial to the flexor carpi ulnaris and comes to the lateral side. This is what you have to write in forearm. This is what is the course of forearm. Okay, so upper 1/3, that is present back of the flexor carpi ulnaris, and our lower 1/3, it passes superficial and lies on the lateral aspect of the flexor carpi ulnaris. Right. So here, see, in axilla and arm there are no branches, but once it enters the forearm, there are branches for ulnar nerve. So what are those branches? We'll see ma. Okay, so these are the branches of forearm, ulnar nerve in forearm. Okay, so I'll show you in a very well manner. I'll show you. Okay, so see, so only it gives three branches ma. That is three sorts of branches. That is muscular branch, then palmar cutaneous branch, and dorsal cutaneous branch. Okay, so muscular branch, okay, it supplies only, it innervates only two muscles ma, flexor carpi ulnaris and flexor digitorum profundus. This is very important. Flexor digitorum profundus, that is only medial half. Sorry, okay, handwriting is very bad. Medial half ma, because lateral half is supplied by median nerve. Okay, lateral half is supplied median nerve ma. So ulnar nerve supplies flexor digitorum profundus only the medial half. Okay, I'll show you. See, after entering the forearm between the two heads of flexor carpi ulnaris, okay, by passing out of the cubital tunnel, can you able to see this branch given to this is what called as flexor digitorum profundus. muscle. Okay, muscular branch. This is one muscular branch. That is only medial nerve. The only medial nerve is supplied by ulnar nerve. The lateral nerve is by median nerve. Okay, fine. So then what? One more twig. Can you able to see this one? Flexor carpi ulnaris. So this one twig. Okay, so muscular branches are only two. One is medial nerve of flexor digitorum profundus, and flexor carpi ulnaris. Then palmar cutaneous branch. Okay, what is the term called palmar, and what is the term called dorsal cutaneous branch? Means, see, palmar cutaneous means, see, hand is going to supply the hand, that is the palmar aspect, the anterior aspect. Dorsal cutaneous branch means it is going to supply the posterior aspect of the hand. That's it, man. Okay, so palmar, that is palmar cutaneous branches means where it is going to supply. It is going to supply the skin over the hypothenar eminence. Okay, it's going to supply the skin over the hypothenar eminence. Can you able to see? See, I will show you. So this is what is ulnar now, right? This is what is ulnar now. You can see the palmar cutaneous branch. Palmar branch, right? See, can you able to see the palmar branch? This is what is the palmar branch. It supplies the skin over the hypothenar eminence. Okay, the thenar eminence is supplied by median nerve. So hypothenar eminence is supplied by ulnar nerve. So you can able to see the palmar branch. This is the palmar branch. It supplies the skin over the hypothenar eminence. Then dorsal cutaneous branch of ulnar nerve. Okay, that is the posterior aspect, right? This supplies the dorsal aspect of the medial 1.5 fingers, man. Okay, medial 1.5 fingers. That is medial 1.5 fingers means medially. See, the complete. This is very important, man. Very, very important. Okay, so this supplies only the anterior aspect. Sorry, only the dorsal aspect. Dorsal cutaneous branch of ulnar nerve supplies only the dorsal aspect of the medial 1.5 fingers. Okay, because anterior aspect of the medial 1.5 fingers is supplied by another branch of ulnar nerve. Okay, that arises from the hand. So because it's very important, because it has a clinical also. Okay, please do understand. Dorsal cutaneous branch supplies cutaneous innervation to the dorsal aspect of the medial 1.5 fingers. Medial 1.5 fingers means that is the complete anterior aspect of the little finger and the lateral aspect of the ring finger. Okay, I'll show you the deep branch. So this is the deep branch. It supplies the. See, can able to see this one. This is what the dorsal branch. Okay, I can't show the arrow properly, so please do see. It is down. It is there, right? So can able to see that. See this one, my dorsal branches. Okay, dorsal branch. Can able to see the three arrow is showing. Okay, that is the ring finger. Okay, so the ring finger. Sorry. So the lateral aspect of the ring finger. Okay, and the little finger, the complete little finger of the anterior aspect. Okay, this is what it is mean as medial 1.5 fingers. Medial 1.5 fingers means this is what it means. Okay, this was the branches of forearm, ulnar nerve in forearm. Okay, this is also okay. This is one more picture depicting the branches. Can you able to see? See, ulnar nerve arises. It supplies flexor digitorum. It supplies flexor digitorum profundus over here. Okay, then the dorsal branch of ulnar nerve, then palmar branch, like that. Now what happens at the wrist? Okay, so ulnar nerve has crossed the axilla, has crossed the arm, has crossed the forearm. Now what happens to the wrist? So in the wrist, ulnar nerve passes superficial to the flexor retinaculum. This is what we call as flexor retinaculum. So see, this is ulnar nerve, right? So ulnar nerve passes superficial to the flexor retinaculum. Okay, this one point I forgot to say. See, throughout the course. Sorry, wait one sec. Throughout the course, ulnar nerve is accompanied by ulnar artery. Okay, so in forearm, throughout the course, ulnar nerve is accompanied by ulnar artery. Oh, that is together they will course. Okay, they will descend. Ulnar nerve is accompanied by ulnar artery. That one point you include. Okay, fine. So at the wrist, what happens? The ulnar nerve passes superficial to the flexor retinaculum. Can you able to see? Superficial to flexor retinaculum. Okay, after passing superficial flexor retinaculum, it just lying. Okay, it passes to a tunnel. I already said whenever there is a joint, the ulnar nerve should be protected, so they will be creating a tunnel, right? So here also a tunnel has been created, okay, lateral to pisiform bone. This is what is called as pisiform bone, lateral to pisiform bone. Here it is created a tunnel, okay, here it is created a tunnel. The tunnel is known as volar carpal tunnel, because volar carpal tunnel, or we can say as ulnar tunnel. Ulnar tunnel. Why ulnar tunnel means? Okay, so why ulnar tunnel means the tunnel is created by volar. See, this is what is. What it is? See, ulnar nerve is coming. Okay, is leaving the forearm. Okay, so passes superficial to the flexor retinaculum. This is what is flexor retinaculum, superficial flexor retinaculum. Okay, lateral to pisiform bone. Okay, so and it passes through a tunnel. That tunnel, okay, tunnel. This is the tunnel. Okay, passes through a tunnel that is called as volar carpal tunnel because the tunnel is created by the enclosement of volar carpal ligament. Volar carpal ligament enclosing. Okay, so the passage of ulnar nerve creating the passage into a tunnel, volar carpal ligament. So it is called as volar carpal tunnel, or otherwise called as ulnar tunnel. Ulnar nerve is causing, right? So it is called as ulnar tunnel. Okay, so I said in the forearm, right? So ulnar nerve is accompanied by ulnar artery. So can you able to see over here? This is ulnar nerve, and this is ulnar artery. Can you able to see this ulnar artery, ulnar nerve in forearm? Okay, that point you have to write. Fine, ma. This is what happens in the wrist. Now, what happens in the hand? Now, tunnel worm has successfully crossed the wrist. Now it enters the hand. Okay, after entering the hand, what happens? That is distal to pisiform. See, after distal to pisiform. Okay, this is pisiform bone. After entering the hand, distal to pisiform, it divides into two branches. One is superficial branch. This is the superficial branch. And one more is a small, that is a deep branch, superficial branch and deep branch. And able to see the superficial branch and deep branch of ulnar nerve. Okay, in this picture I'll be explaining the superficial branch. Okay, alone superficial branch alone. Okay, superficial branch is completely a sensory nerve. Okay, because it supplies the sensory aspect, so it supplies only one muscle of the hypothenar. So that is 𝗵𝗲𝗏𝗏 is one of the muscles of hypothenar. Okay, so superficial branch is 99%. It is a sensory nerve, but it supplies only one muscle that is called as 𝗵𝗲𝗏𝗏. This is very, very important, So superficial branch ulnar nerve supplies to only one muscle, that is one of the muscles of hypothenar. This is 𝗵𝗲𝗏𝗏. It's a very important MCQ question in PG entrance exam. Okay, please do notice. Okay, that's why I said all the nerves are very important. Okay, regarding clinical aspect as well as an examination point of view. Okay, so please do understand and read once after this session. So what happens to the ulnar nerve? So superficial branch of ulnar nerve, after giving a branch to 𝗵𝗲𝗏𝗏, okay, what happens? It is divided into two digital branches. See, this is one digital branch and this is one digital branch. What does digital branch means? It is going to supply inner weight, that is the sensory innervation to the digits. These digits. Okay, this is what I said. I said here I said this. Dorsal cutaneous nerve supplies cutaneous innervation to the dorsal aspect of the middle 1.5 fingers. Okay, dorsal aspect is supplied by dorsal cutaneous nerve. Then what happening to the palmar aspect? The palmar aspect is supplied by superficial branch of ulnar nerve. It's supplied by palmar aspect, same medial 1.5 fingers. Okay, then but how does it supplies means? So the ulnar nerve, superficial branch of ulnar nerve is divided into two digital branches. Okay, so two digital branches. One is common digital branch. This one is called as common digital branch, and another one is called as proper digital branch. This is proper digital branch. Why it is called as common digital branch means this is going to divide once more into two proper digital branches. Okay, one common digital branch dividing into two proper digital branch, and here it is only one proper digital branch. So this two proper digital branch is going to supply the lateral aspect of the ring finger, the middle aspect of the ring finger and the lateral aspect of the little finger. Okay, so and this one proper digital branch is going to supply the middle aspect of the little finger. So middle 1.5 fingers is supplied, middle 1.5 fingers of the superficial aspect, that is the palmar aspect, is supplied by superficial branch of ulnar norma. Okay, ulnar norma. Fine. So this is what you have to write in superficial branch. What happens to deep branch? So this diagram will be essential to see what happens to deep branch. What happens? Okay, so deep branch. So see, as I said, always when a nerve passes through a joint, so it has to be safeguarded. So because of wide range of movements of the joints, okay, so the nerve has to safeguard. So it forms a tunnel. Same thing. What? So the joint to move. Okay, joint will move, right? So the movement of joint, what helps? Muscles only, right? So the two muscles are getting contracting. Proximally one muscle is getting contracting, and distally one muscle is getting contracting. In between joint is there, so joint is moving. So the only right. So this deep branch is predominantly, that is completely 100% is a motor branch, because it's going to supply all the intrinsic muscles of the hand. That is also the 95% of the intrinsic muscles of the hand. So it's going to supply the n number of many intrinsic muscles of the hand. That is, intrinsic muscles means nothing but the muscles of the hand. Okay, muscles of the, don't worry, muscles of the hand will be dealt in another session called hand. Just as of now, remember this, the deep branch of ulnar now supplies all the, that is 95% of the intrinsic muscles of the hand. Okay, so 5% and some of the intrinsic muscles of the hand is all supplied by median nerve. Okay, so how does this form? How does it supplies? We'll see. So the deep branch, what happens? So since it supplies many muscles, right? So many muscles will contract. So in order to safeguard the deep branch also, what happens? It creates a tunnel to safeguard itself. Nature has created a tunnel. So see, so this is the tunnel. Okay, or tunnel or canal, anything. Okay, we can say. So this is the ulnar nerve. Okay, after passing from coming out from the forearm, entering the wrist, superficial to flexor retinaculum, lateral to pisiform bone, lateral to pisiform bone. Okay, leaving the wrist, dividing into superficial and deep, right? So the deep, this is the deep branch of ulnar norma. Okay, this deep branch of ulnar nerve, okay, is protected by converting the passage into a canal. That canal is called as Guénon's canal. Guénon's canal. Okay, the passage is called as Guénon's canal. Okay, or 𝗵𝗂𝗵𝗏 canal. Why it is called as 𝗵𝗂𝗵𝗏 canal means because a facial band. Okay, a facial band is extending from the pisiform bone. This is the pisiform bone, and this is the hook of 𝗵𝗏. Okay, this is called as hook of 𝗵𝗏. So from the pisiform bone to hook of 𝗵𝗏, this is going to extend the facial band. So that facial band is converting the passage of deep branch of ulnar nerve into a tunnel that is called as Guénon's tunnel, since it's extending from the 𝗵𝗂𝗵𝗏 bone, extending from pisiform bone to 𝗵𝗏. This is otherwise called as 𝗵𝗂𝗵𝗏 tunnel. Okay, fine. So once it enters the 𝗵𝗂𝗵𝗏 tunnel and comes out of the 𝗵𝗂𝗵𝗏 tunnel, it starts supplying all the see, this will be very efficient picture to represent the innervation of deep branch of ulnar nerve. See, once it comes out of the tunnel, Guénon's tunnel, it supplies all the muscles. See, abductor digiti minimi, flexor digiti minimi, operans digiti minimi, so lumbricals, so 𝘂𝐿. So all these are intrinsic muscles of the hand mass. So these are lumbricals. Can you able to see these are all the lumbricals? 1, 2, 3, 4. We have 4 lumbricals. Okay, 1, 2, 3, 4. Likewise, okay, 4 lumbricals, and also 𝘂𝐿. Okay, one more important, 𝘂𝐿. You will have 𝘂𝐿. We have 7 𝘂𝐿. If I show you here, see, we have 7 𝘂𝐿. Okay, so palmar 𝘂𝐿 1, 2, 3, and dorsal on the posterior aspect 1, 2, 3, 4. Okay, we have 𝘂𝐿. These all are supplied by deep branch of ulnar nerve. So once it supplies, it has to terminate, right? It terminates. Okay, it terminates by supplying adductor pollicis muscle. By supplying the adductor pollicis muscle, it terminates. Ulnar nerve gets terminates. Deep branch of ulnar nerve gets terminates. Okay, this point is very important, ma. Okay, it terminates by supplying the adductor pollicis muscle. Okay, why it is important? I'll show. Okay, we'll discuss in the clinical aspect, because it is going to represent a very important sign called Formant Sign. Okay, we'll delve in the clinical aspect. This is what this is what the complete aspect of course of the ulnar nerve. Okay, starting what and all I have said. Okay, what and all I have said, you represent as a flow chart. Okay, what happens in axilla, arm, forearm, wrist, hand. Okay, and draw this diagram. Okay, what and all I have said, that is what is in the diagram. Okay, so see axilla. Okay, so axilla, okay, so the axillary artery, okay, medial to axillary artery, and enters the arm. In arm proximally, it is medial to a brachial artery and passes the medial intermuscular septum, and in distally it passes behind the medial epicondyle to, okay, so in a tunnel called cubital tunnel, and enters the forearm between the two heads of flexor carpi ulnaris. Okay, as I said, right, throughout the course of the ulnar nerve in the forearm. Okay, so it accompanies the ulnar artery. Okay, that has been given, and its branches in the forearm, and its branches in the hand. These all are very well appreciated in this diagram. Okay, so please draw this diagram and write it has a flow chart. This will definitely give you 10 to 12 marks 10 to 12 marks out of 15 in university examination. Okay, please do. Okay, the ulnar nerve is not over. Now we are going to understand. Doctor, please stay with me, doctor. Okay, so I'm going to finish within 15 minutes. Okay, so we are going, so these are the muscles okay, deep branches muscles: palmar 𝗏𝗏, operans digiti minimi, abductor digiti minimi, flexor digiti minimi, third and fourth lumbricals. Okay, yeah, this is very important. Lumbricals, only third and fourth lumbrical, okay, is supplied by ulnar nerve. So see, only the third and fourth lumbrical, okay, only this and this is supplied by ulnar nerve. Okay, the first second lumbrical supplied by median nerve. Okay, so ulnar nerve is supplied by only third and fourth lumbrical, and all the interosseous is supplied by ulnar nerve only. Okay, fine. So I said palmar is brevis is supplied by superficial branch of ulnar nerve. See, this is what I said right in starting the session. I said ulnar nerve is otherwise called as musician's nerve. I asked you to put a question mark, right? Now I'll say the answer. Okay, so why ulnar nerve is called as musician's nerve? Because it supplies all the intrinsic muscles of the hand. That is the predominantly 95% of the intrinsic muscles of the hand. Okay, these muscles, what happens, will help in intricate fine movements, hand movements, any hand movement. Okay, if you see these music 𝗵𝒂𝒂𝗃. Okay, if you see the music 𝗵𝒂𝒃, Mr. A.R. Rahman or Yuvan Shankar Raja, 𝗬𝗏𝗏 of anybody. Okay, or if you see the famous veena player 𝑟𝑎𝑗𝑒𝑠 if you see his hand, okay, it will be like a string. Okay, it will be like what, tornado. Okay, he's swinging his hand, he is playing his hand. Okay, see these two people, okay, playing a piano. So they are going to move the hand, right? So in fine intricate movements of the hand. So in order to do these fine intricate movements, ulnar nerve is needed. Okay, ulnar nerve supplies the intrinsic muscles of the hand, so the muscles provide this movement. That is why ulnar nerve is otherwise called as musician's nerve. Okay, fine. Now we'll go to the clinical anatomy. Okay, now we'll go to the clinical anatomy. So clinical anatomy, okay, so what happens? So clinical anatomy. Okay, so ulnar nerve injures at only two sites, that is, one is at the elbow and another is at the wrist. Okay, one is at the elbow and another is at the wrist. Okay, so normally, because these are two are the joints, right? So normally joints are the nerve injury nadakum. But I said, okay, so joints so in order to safeguard ulnar nerve, nature has created a tunnel. But apart from the tunnel, if the ulnar nerve compressed in the tunnel itself, what will happen? So in major accidents, so at that time ulnar nerve gets injured. Okay, so what is the clinical behind it? Okay, so see, so in your book called in the Vishram Singh, it will be like what, it will be collapsed. Okay, so I have made it very simple clinical, because see, till the root value course everybody will write, but the problem is when it comes to clinical side, okay, they won't understand properly. So if you want to understand clinical properly, and if you want to write clinical properly, you have to understand the pakka cause and root value. Okay, ma. So I have made it very simple. You please understand the 6 points, ma. The 6 points. Okay, the 6 points are very important. Okay, understand the 6 points. Okay, the clinical anatomy of ulnar nerve is finished. Okay, this 6 points. First of all, atrophy and flattening of ulnar nerve. What do you mean by that? Atrophy and flattening of atrophy and flattening of hypothenar eminence. Okay, see, injury at the level of elbow. Okay, so what happens? There's atrophy and flattening of hypothenar eminence. Yeah, definitely, because I already said, so ulnar nerve supplies the hypothenar muscle, right? So all the hypothenar muscles are, so what happens? So if it's injury at the elbow, hypothenar eminence is getting flat and atrophy. Then very important, what do you mean by claw hand deformity? So for this, you have to understand very important function of a muscle. Okay, lumbrical. Okay, so that's why. Okay, so I'm not going to explain all the intrinsic muscles of the hand. It will be dealt in a separate session, but I will be explaining only 2 muscles. Okay, that is also I'm going to explain the function of the 2 muscles, which is very important for the injury of ulnar nerve. Okay, so first of all, lumbricals. What do you mean by lumbrical? Lumbrical is one of the intrinsic muscles of the hand. Lumbrical. Okay, so this is lumbricals. Okay, I said this is what lumbricals are. You have 1, 2, 3, 4 lumbricals we have. Okay, so what is the function of lumbricals? Okay, so this sign. Okay, so if you are, suppose if you are in a crowd, how you will call your neighbor? You will call like this, right? You will call like this. Hey, come here. You will call like this, right? So to produce that, so 2 things happen. That is flexion of 𝗵𝒂𝒂𝒄𝗃 joint. That is 𝗵𝒂𝒂𝒃 joint. That is joint between metacarpal and phalanx. So 𝗵𝒂𝒂𝒃 joint and extension of interphalangeal joint. Joint between 2 phalanx, interphalangeal joint. These 2 functions is provided by lumbricals, ma. Flexion of 𝗵𝒂𝒂𝒃 joint and extension of interphalangeal joint. Okay, can you able to understand this? Because this lumbricals and intraossei, I'm going to explain intraossei also. This lumbricals and intraossei functions you have to remember till your end of the first year. Not only first year, till the end of your medical career, because this lumbricals and intraossei functions is very important. They will be asked in your next year, in next clinical year, second year also they will ask. Once you enter the clinical session, they will ask what is the function of lumbricals. Okay, then it is also very important 𝐈𝐴 also. Okay, examiners are allowed to ask what is the function of lumbricals. Nothing, you keep your hand like this in this position and you can itself say the function of lumbricals, flexion of 𝗵𝒂𝒂𝒃 joint and extension of interphalangeal joint. Okay, so what happens in claw hand? Since the ulnar nerve is paralyzed, that is injured at the elbow, this function of lumbricals is getting reversed. That is what happens, producing a claw hand deformity. That is, see, I'll show you the picture. This is called the claw hand, ma. This is called the claw hand. Can you able to understand? See, normally what is the function of lumbricals? The function is flexion of 𝗵𝒂𝒂𝒃 joint and extension of interphalangeal joint, right? So, but in claw hand, what happens? The function is reverse. See, there is extension of 𝗵𝒂𝒂𝒃 joint and flexion of interphalangeal joint. This is what is called as claw hand. Okay, that 2 claw hand occurs in only little finger and ring finger, because if the claw hand occurs in first 2 fingers, okay, that is in the index finger and the second finger, that is due to median nerve. Okay, that is due to median nerve, ma. Okay, but if the claw hand occurs in the little finger and the ring finger, that is due to ulnar nerve. Okay, that is claw hand deformity, ma. Then what do you mean by loss of abduction and adduction of fingers? I'll explain this. Okay, so for this only you have to understand the intraossei. Okay, intraossei is one of the muscle of intrinsic muscles of the hand. Okay, intraossei, so you have 7 intraossei, ma. So in the palmar aspect, or that is in the anterior aspect of the hand, you have 3 intraossei, and on the dorsal aspect you have 4 intraossei. Okay, so to know the function of each and every intraossei, the palmar intraossei has a unique function, the dorsal intraossei has a unique function. To know, please remember the mnemonic. Okay, for palmar intraossei, the mnemonic is pad. Okay, pad. For dorsal intraossei, the mnemonic is dab. Okay, what do you mean by pad, dab? See, pad means nothing but, see, P for palmar intraossei. Palmar intraossei adducts. See, adductas. So adducts, okay, it adducts. Okay, it adducts your hand. Okay, adducts the finger. That is what is called as, that is the function pad. And dorsal interosseous, what happens? See, D for dorsal interosseous, it abducts. So it abducts. Okay, yeah. Okay, lama. It abducts. This adducts your fingers. That is what is called as pad and dam. Okay, these two functions, please do remember, ma, till your last profession of your medical career. Okay, please do remember, this is dealt in many clinical cases. Okay, patients will definitely come with this ulnar injury, with this flex and with this claw hand deformity, that is due to lumbricals. Okay, and loss of abduction of fingers, that is due to interosseous. So please do remember the function of lumbricals, that is flexion of 𝗵𝒂𝒂𝒂𝗃 joint and extension of interphalangeal joint, and interosseous function, palmar interosseous pad and dorsal interosseous dab. Okay, so since ulnar nerve okay, is needed for the innervation of these palmar interosseous and dorsal interosseous, since it has injured, the loss of abduction and adduction of fingers occurs. Okay, so then depression of interosseous spaces. See, since interosseous muscle has paralyzed, right? So interosseous muscle has paralyzed, that is atrophied. So what happens? There will be a depression. This is a clinical sign, ma. There will be a depression in interosseous spaces. I'll show a picture. See, unable to see the depression. There's a depression in the ear and all. You will be having a interosseous space, ma. So what happens? So there will be a depression of interosseous space due to paralysis of interosseous muscle. Okay, then loss of sensation over this is medial aspect. I'm very sorry, ma. This is medial aspect. Very sorry. I'm very sorry, ma. This is medial aspect. Sorry. Okay. See, because lateral aspect is medial now. Okay, medial aspect. Very sorry, ma. Okay, middle aspect. Okay, middle, loss of sensation over middle aspect of 1.5 fingers. I already said, right, middle ulnar nerve supplies innervation, sensory innervation to the middle 1.5 fingers. I already said middle 1.5 fingers. I said, right, these middle 1.5 fingers. So there will be a loss of sensation of middle 1.5 fingers. And Formant sign positive. What do you mean by Formant sign? What do you mean by Formant sign? That is what I said, right? I said to remember this very important ulnar nerve. This deep branch of ulnar nerve terminates by supplying flex adductor pollicis muscle, right? I said you to remember this muscle because this is what the pakka background, the key background of this Formant sign, what it is. Okay, so if a patient comes to a clinician or a doctor, that is, I have these 6 signs. Okay, so how the doctor elicit that ulnar nerve has injured means he will do a test. Okay, he will do a test, so the patient will show a sign. That sign is called as Formant sign. Formant sign. Okay, the sign is called as Formant sign. Okay, if the ulnar nerve has injured, the Formant sign is positive. If the ulnar nerve is not injured, the Formant sign is negative. Okay, how we will do? Okay, this is what is Formant sign, ma. So how we will do? Okay, so we'll see. Imagine this is the doctor's hand or the clinician's hand, and this is the patient's hand. Okay, the doctor will give a paper or eraser or any material to hold okay, so to be hold to the patient. Okay, the paper and the doctor will say to the patient to grasp the paper or eraser or any material from his hand, to grasp the paper. Okay, so grasp the paper. Okay, then doctor will also pull simultaneously, and patient should also grasp the paper. Doctor will pull, patient should grasp. So doctor will feel some resistance. That is okay, the doctor will feel some resistance. But what happens, you try in your home itself. Okay, you keep a paper in between two hand. Okay, one hand you pull the paper. Okay, another hand you feel the resistance. What happens, the hand which you are pulling the paper, okay, so this is very important. Okay, I forgot to say, the patient should pull the hand pull the paper in his index finger and the thumb finger, ma. Okay, the patient should should pull the paper only in the index finger and thumb finger. Okay, when he pulls the paper in the index finger and thumb finger, the thumb finger, it gets flexed. Normally if you pull, okay, so when you try it in your home, when you pull pull the paper, okay, so keeping the paper in between the two hands, when you pull the paper, your thumb will not flex, it will be straight, okay. But in Formant sign, the thumb is flexed. Why? Because since the pain, see, since the adductor, see, since the ulnar nerve is injured, adductor pollicis muscle is paralyzed. So what is the function of adductor pollicis muscle? Its function is to adduct the finger. So the adduction is lost. So since adduction is lost, flexion takes place in place of adduction. So what happens? Flexor muscles come in action. So the thumb becomes flexed. So with the help of this sign, doctor will say you have an ulnar nerve injury. Okay, you have ulnar nerve injury. Okay, this is what the sign is called, Formant sign. Okay, so this is at the level of injury at the level of elbow. So what will happen? Injury at the level of wrist. Okay, all these 5 points will be points will be there, okay, but one point will be missing. Okay, at the injury at the level of elbow, one point will be missing. Was that this point will be missing? This point will be missing. Okay, loss of sensation over middle 1.5 fingers. Why? Because this is what I said. Why? Because see, ulnar nerve is injured at the level of wrist, right? But I said for sensation over middle 1.5 fingers, I said superficial branch supplies palmar aspect, and this dorsal cutaneous branch supplies a dorsal aspect. But this dorsal cutaneous branch arises in the ulnar nerve, where it is caused in the forearm itself. Okay, since the injury is at the level of wrist, so the twig comes from the forearm is saved. Okay, but the twig comes from the wrist. Okay, but the twig comes from the superficial branch, right? But the superficial branch is not saved. Okay, but you will have loss of sensation in the palmar aspect, but you don't have loss of sensation in dorsal aspect. Since you don't have dorsal, so sensation, complete loss of sensation in dorsal aspect, so this point won't come. Okay, you will have some sensation dorsal aspect, right? So எந்த ஒரு சென்சேஷனும் இல்லைனா தான் என்ன பண்ணுவாங்க டாக்டர், நமக்கு வந்து தோணும் ஓகே சென்சேஷன் இல்லை அப்படின்ட்டு. ஏதாவது ஒரு சென்சேஷன் இருந்துச்சுன்னா சரி, இன்னொரு கையிலேருந்து சென்சேஷன் வந்துடும் அப்படின்னு will have that feel, right? So that is what happening. Okay, then very importantly, you will have this ulnar paradox. Okay, injury at the level of wrist, you have to say about ulnar paradox. What do you mean by ulnar paradox, sir? You have to understand, okay. So each and every nerve will have a unique clinical aspect. Okay, if you take radial nerve, you have Saturday night palsy. If you take medial nerve, you will have carpal tunnel syndrome. Likewise, if you take ulnar nerve, you will have ulnar paradox. This is very, very important. You will have each nerve has its own clinical significance. You will have ulnar nerve. You will have ulnar nerve will have ulnar paradox. What do you mean by that? See, normally we know, right? Normally, if we take any nerve, more the lesion, more the injury, right? So see, injury at the level of elbow. So this many lesions have been taken place. 6 lesions have been taken place. But see, injury at the level of wrist, only 5 lesions. One lesion is lost, right? But what happens in ulnar paradox? It happens opposite to that. That is, what I'm trying to say is, in ulnar paradox, this claw hand deformity, right? This claw hand deformity. Okay, on this claw hand deformity in injury at the level of elbow, it happens to some extent. Okay, happens to some extent like this. Okay, but in ulnar paradox, that is the injury at the level of wrist. Okay, the injury at the level of wrist, this claw hand deformity occurs more pronounced. Okay, little stent to this claw hand deformity. That is because there's more clawing. That is more clawing happens. Okay, clawing இருக்குங்களையாமா, இந்த clawing வந்து இன்னும் ரொம்ப நிறைய நடக்கும். Okay, for example, see, suppose the injury at the level of elbow, clawing. Suppose you don't have clawing here. Suppose I'm saying this is clawing, right? This is something curve is clawing. Okay, you have an injury at the level of elbow, you have this much of clawing. But injury at the level of wrist, you have this much of clawing. You will have this much of clawing. This is due to flexion of flexor digitorum profundus. Because see, so because ulnar nerve gives a branch. I already said in the forearm, ulnar nerve gives a branch to flexor digitorum profundus. What is the function of flexor digitorum profundus? Flexion, right? So since ulnar nerve is damaged only in the wrist, so this twig is safeguarded. So flexor digitorum profundus is ready to flex. So more clawing happens. But if so, ulnar paradox is seen in the injury at the level of wrist, but injury at the level of elbow, there won't be this much of clawing. Okay, because this is flexor digitorum profundus itself will be getting paralyzed. This is what ma. Okay, this one. Okay, this is what I want to. This is the sensory loss ma, on the medial 1.5 fingers. Okay, this is the space in. There is a space I shown you, right? That interosseous space depression. I shown this depression of interosseous space. That is what this. Okay, this is Formant sign. This is what space. This is what's the ulnar nerve ma. This is what the ulnar nerve. Then we'll see what is complete claw hand. Okay, I said medial. Okay, so the little finger, if the clawing happens in the little finger and ring finger, it is due to ulnar nerve. In the first finger and second finger, this is due to median nerve. What will happen if all these fingers get claw? That is due to complete lesion. That is complete injury to the ulnar nerve and median nerve. If the median nerve and ulnar nerve both are getting injured, there will be a condition called as complete claw hand. So they will be complete. Can able to see the complete claw hand takes place. In complete claw hand, what happens? There will be hyperextension of the wrist. Okay, there will be can able to see the wrist will be hyperextended. Another straight targoma. Okay, wrist on the hyperextended. Hyperextension of the wrist and 𝗵𝒂𝒂𝒃 joint. This 𝗵𝒂𝒃 joint will be hyperextended and flexion of the interphalangeal joint. That is what I want to say, ma. Okay, thank you, ma. If you have any doubts, please put in the comment section. I'll be seeing through it and I'll be clarifying your doubts. Okay, thank you.